Iron deficiency and sports anemia. Iron deficiency is common in athletes, especially endurance athletes, such as marathon runners, long-distance cyclists, swimmers, and even rugby players. Iron deficiency in athletes can lead to sports anemia, which is a state of fatigue and leads to poor performance. This is due to increased iron loss through sweat, exercise-induced blood cell destruction, and potentially a lower intake or absorption of iron. Some side effects and symptoms of this can include fatigue and reduced endurance. Iron deficiency and sports anemia can also be confused with overtraining. So what is it? Iron deficiency is a condition where the body lacks enough iron, a mineral that is essential for producing red blood cells that carry oxygen through the body. We need iron because it is crucial for producing hemoglobin. Hemoglobin is an iron-rich protein inside red blood cells that transports oxygen from the lungs to the body's tissues and carries carbon dioxide back to the lungs. It is essential for cell function and energy production. Sports anemia. Sports anemia can refer to two things. The first is heteromelution. Heteromelution is a temporary harmless condition where increased plasma volume expands the blood, diluting red blood cells and hemoglobin. This occurs due to intense training, but the body's total red blood cell mass increases over time to compensate. Heteromelution does not require treatment and is often actually a sign of good adaptation to exercise. The second condition is true iron deficiency anemia, which is what we talked about before, where it is caused by insufficient iron in the body, which leads to reduction in healthy red blood cells and hemoglobin. This disorder can result in a severe decrease in work capacity and your VO2 max in the case of endurance athletes. Some endurance athletes engage in blood doping, which is where they are increasing their red blood cells through blood transfusions to boost oxygen transport and aerobic capacity, their VO2 max. While it can help with endurance, it is banned in competitive sports due to ethical and health concerns. So how do you get it? How do you get iron deficiency and sports anemia? This can happen due to factors like mechanical stress from impact, such as running, intense and demanding exercise, blood loss from minor digestive system issues and urinary tract damage, heavy sweating, and a diet that doesn't provide enough iron to replace what it's lost. For women, it is more common to have an iron deficiency due to their menstrual blood loss, and if they are an athlete, they are more prone to having sports anemia. What are the symptoms? Some symptoms of sports anemia and iron deficiency can include fatigue, pale skin, poor performance, shortness of breath, having a fast heartbeat, dizziness, frequent illness. Some more that could be more specific to athletes include underperformance, reduced endurance, loss of power, jelly legs, and having a poor mood. To be diagnosed, it's important to take a blood test as symptoms can be similar and confused with overtraining, as I mentioned before. What is the recommended intake? The daily iron requirements vary by age and gender. With women, they have to age 19 to 50 should be taking 18 milligrams a day. Men and women over 51 should be taking 8 milligrams a day, while pregnant women should be taking 27 milligrams and teenagers should be having 11 milligrams for males and 15 for females, age 14 to 18. What are the treatments and cures? Well, there is no specific cure for sports anemia as it is caused from different reasons as we discussed before. There are a few approaches which can work differently, such as taking iron supplements, going to your GP to get an iron infusion, and treating underlying causes, such as your diet. So making sure that you're eating iron-rich foods such as spinach, kale, tofu, and lentils. Most people can actually prevent iron deficiency by getting enough iron in through their diet. Thank you.